acupuncture is the ultimate longevity tool. We do know that it works.
Are you sad? Are you ill?
Yeah.
Are you not feeling your best? Try acupuncture.
Are you wanting to recover faster from an injury? What it does is it allows the body, through optimization of brain function, to properly manage your physiology, your cell function, your insulin, your endocrine system, your hormones. All of that can be done and optimized through acupuncture. We know it works through the nerves and that it stimulates the brain.
Acupuncture can help your mood and your recovery.
Yeah, exactly. Isn't that fantastic? A lot of people work out to improve their mood.
A lot of people do a lot of things to improve their mood.
Yes. And then their working out causes soreness and achiness and stiffness. And then they're like, what do I do now? Acupuncture.
So we have this model of a human on the desk. I wanted to acknowledge that that's there to show what acupuncture can do.
Is that YouTube approved?
I don't know, maybe show it from the back.
How about there? There we go.
What does acupuncture do? A lot of people are afraid of needles. They think this is woo-woo stuff. Maybe they think it's fine, but they just don't do it themselves. I want you to convince them as to why they should be doing acupuncture.
Oh, absolutely. You know, for a long time, for many years, people have said, well, yeah, acupuncture, that's cool, that's good. You know, we think it works, but we don't know how it works. And people have said that for a long time. And the reality is we do know that it works, and they're acknowledging and saying that now. And the fact of the matter is we know some of the mechanisms of how it works as well. One of those is neurologically. We know it works through the nerves and that it stimulates the brain. So we've actually done MRI imaging studies where they've tested people's brains, put them on functional magnetic resonance imaging, which essentially is you can see what's happening in the brain in real time. So you can see, you know, a patient, if they, hey, do a math problem or solve this word, you know, crossword puzzle or whatever, you can see them doing those things. You can see what part of the brain it lights up, what it activates. So what we do is we put someone under functional magnetic resonance imaging, and then we blindfold them. We say, okay, we're going to blindfold you. We know exactly the occipital lobe. We've shined a flashlight in the eye previously. Now we blindfold them, and then we insert a needle into a point down on the lower extremity that's good for the eyes on the lower leg. And then we see almost the exact same signal as shining a flashlight in the eye. So we see that happen specific to that cortical region of the brain that relates to vision. Okay. So what we know is you insert a point distally, it's going to improve function. It's going to activate that part of the brain that regulates the health of the eye. That's pretty cool.
Why am I listening to you? I just realized we haven't introduced ourselves.
Yeah, that's okay, but I'm answering your questions. You got right to business.
I did get right to business.
Sometimes it's like, let's just get the answers. Right?
I know, and I want to introduce, I'm Nick.
Yeah.
I'm a co-host of the Be Well Now podcast. I'm a patient of yours. You're Dr. Ron Dummar. You happen to be an acupuncturist? Is that the right term?
Yes, I practice acupuncture, Chinese medicine as well, and functional medicine, and my background's in as a chiropractic physician and Chinese medicine.
Sometimes when people are, going through what they're going through, and they explain, I got this thyroid issue, or I have this pain, they don't want you to tell them. Maybe they ask you for things because you're a doctor, but like people rarely want to be told what to do. They want to be listened to. Anyways, what I want to tell most people is like, just try acupuncture.
Oh, for sure.
Like just start there. Mm-hmm. Are you sad? Are you ill?
Yeah.
Are you not feeling your best? Try acupuncture.
Are you wanting to recover faster from an injury? Right? Are you wanting to improve angiogenesis? Are you wanting to improve ligament and cartilage formation? Are you wanting to improve the way that your body functions overall? Like, think about it. Acupuncture is the ultimate, has been for millennia, the ultimate longevity tool, because what it does is it allows the body, through optimization of brain function, to properly manage your physiology, your cell function, right? Your insulin, your endocrine system, your hormones, all of that can be done and optimized through acupuncture. So, yeah.
So acupuncture helps the brain?
Oh, 100% helps the brain. Helps improve blood flow and function to the brain, to parts of the brain that may not be functioning as adequately, that may, because of them not functioning as adequately as possible, are causing a disruption within an organ system of your body.
There's all kinds of numbers and graphs and lines on this human body, this model. What do those represent? I'm guessing those are acupuncture points, but meridians?
These are all points. These are all points that are related, and there's a lot more points than this as well, but these are related to specific nerves in the body that relate to organs and organ systems. So you have to, in order to understand this concept, a lot of people don't quite get it. They don't understand exactly how this whole reference back to the brain makes sense. But all you have to do is start from this spot right here. So, okay, if I am around someone and I see them massaging or reaching for their hand and being like, oh my gosh, I'm not feeling well, and they're rubbing their hand, what are you thinking? I have pain in my hand. What's going on? What you're thinking, especially as a medical provider, is maybe they're having a heart attack. Well, why are they having pain in their arm or their hand? Okay, what that means is that there's a neurological response there. There is a neurological mechanism that sends a signal to the hand. Well, why is that? Well, some of the neurology from the heart, from this part of the body in embryological development, when you're developed as a baby, as a fetus, actually pulled all the way out here into the arm and the hand. Which means now if we have some of the intelligence or structure, nature of the heart neurologically into our arm and hand, we can actually have an influence on heart function by inserting a needle to send a signal to the brain and impact the heart. And we actually know that the acupuncture does that. That's one of the studies that have been done that shows that acupuncture regulates heart rhythms. Okay, so if you have irregular heart rhythm, right, you can actually utilize acupuncture to benefit that. So heart rate variability, we use heart rate variability monitoring a lot. We use it in a treatment we use called heart math as well. But acupuncture improves heart rate variability.
Does it help if you have a headache?
Yes, pain. So all sorts of pain conditions, and this is one of probably the most studied areas of acupuncture is with regard to pain. So back pain, knee, joint, osteoarthritis, inflammatory conditions, immune dysregulation issues, colitis, colon issues as far as gut related and GI. So any sort of inflammatory bowel related issue as well. Acupuncture can have an influence on it because it influences the way the immune system functions. Okay. So yes, your pain can be mitigated using acupuncture. One of the treatments that we offer here is called rapid pain relief acupuncture. And we use auricular acupuncture. So we'll only use ear points for those. And I've studied all sorts of different types of acupuncture and approaches to acupuncture. Every part of the body essentially is like a microcosm of the entire body. So if you look at the ear, it's essentially like an upside down fetus. You can see right here would be the head, okay, and then the neck and the spine, and then it splits right here into those two, and you can put up a picture right up, Nick, for our viewers to see this a little better. But you can see those two legs right there where it splits at the pelvis. So all the internal organs are here, and then you've got the spine structure and the neck and the head right down there. So the ear is like a remnant of the fetus, so we can treat the entire body. Like there are acupuncturists who actually only treat the ear. They'll treat the entire body by putting needles in different parts of the ear. So we do this treatment called rapid pain relief acupuncture. I'll have patients who come in with a significant pain. Usually we treat like migraine, headaches, all sorts of pains that way related from the neck and the upper body. And they'll come in at a 9, 10, some of them say a 15, right? And then we'll put needles in. And I have a process that we go through. We'll put a needle in a specific spot, or we'll test certain spots to make sure where we want to put the needles. And then I have them walk after I put one in. And then I have them rate it again and see. And usually it'll drop a little bit, or sometimes right at the beginning it doesn't have a whole lot of effect. And then I'll put in another needle in a second spot, have them walk around and move around a little bit, kind of reset and see allow the nervous system to kind of check what's going on. And then what will happen is their pain starts dropping. And I put in another one, boom. And then with those patients, we do that until they get down to usually a 2 or a 1 in their pain rating. And then I release them and say, okay, you're good. And those needles are called ASP needles, or battlefield acupuncture needles is what people oftentimes refer to them as. And so I'll send them out, and those needles will stay in their ear for 3 to 5 days. Okay. Now here's a cool thing. There was a study done that actually compared acupuncture to some pain relievers and like morphine. And it found that, well, morphine, you get a dose of morphine, and it's like you get this 6 to 8 hour kind of time where it is effective, right? Well, what they found was with acupuncture, you actually have up to a 3-day window of effectiveness in the treatment of receiving acupuncture. So it even is outperforming in some of these studies the medications that we're using to attempt to mitigate our pain.
I was going to say, if you have anxiety or depression, it can be easy to turn to vaping or smoking or screen addiction or alcohol or cannabis or just like any number of ways to feel better when life feels overwhelming or you're just not a happy person. How could acupuncture help with things like anxiety or depression so folks don't have to go, in those quote unquote easy button ways, but like people know that's not the path.
Yeah.
Get on it. They probably know I shouldn't be doing this. Acupuncture, is it the full answer? Is it part of the solution? Like, how could it help someone who's struggling with anxiety or depression?
Yeah, so it really depends on where you are in your life. And in our clinic, we really believe more in that, is that we're here to support you the very best where you are. So I have patients who are like, hey, I'm on these medications. I don't have plan to get off of them. I just want your support. I want to be healthy. I want to, look at my nutrition. And I say, great. Okay, let's do all that. We'll evaluate labs, right? We'll do acupuncture. We'll put together a plan for you. And then I have other patients who are like, hey, I'm working with my care provider to get off of these medications. I want support from you. And we'll work with them and create a plan also. And then there are those who are like, I don't ever want to be on a medication ever, and I want help from you. And we appreciate and I work with all of those patients, right? And I don't judge them based on whether they're on a medication or whether they're not. It's just something that clinically I have to evaluate and assess when we're creating plans for them. So when it comes to patients, when they're looking at some patients who get on these medications, antidepressant medications, some will look at them and think, oh, it's a weakness, right? It's a weakness if I need to be on a medication. And I don't know that I don't know that that's an appropriate way of looking at it. I think it's just something that at certain points in your life, you may need or you may benefit from, okay? And that's actually okay. And even in that state where you're like, okay, I need to be on this medication, acupuncture can still help. It will still improve your neurology. It will still benefit you by improving the production of neurotransmitters, the availability of serotonin in the neural cleft, GABA. It will still benefit you in significant ways. Okay?
I love that the approach in this office, probably most things you do here, if not all, like the supplements, the Chinese herbs that you literally, have a
formulate
pharmacy,
for patients.
You formulate for patients here, your own unique blends. The side effects are not like negative, right? It seems like you give the body these inputs and it takes what it needs and it sort of like helps benefit certain organ systems, and then it kind of like flushes out what it doesn't. To what extent is that your approach here in terms of side effects of medications and how a lot of the things you do work? Yeah,
so my approach in general is to support the patients where they are. To look at where they are and then to create a plan and a strategy if they have some sort of goals moving forward. Are we looking, ideally, I want to optimize. Like from my personal standpoint, I want to optimize. I want to optimize all my health. And that doesn't mean that I have to be the highest performer ever. No, it means I have to be content with where I am. I have to be able to look back and say, wow, like I used to be way over there and now I'm here. And so part of my journey is a satisfaction and a level of contentedness with where I am, and coincide that with a desire to improve consistently. So that to me is the ideal state. And when I have patients who come in and they're like, look, I'm actually, I feel like I'm fairly healthy. I'm maybe on this medication or whatever, but it seems to be helping me and it's working. I mean, I don't have a whole lot of complaints, but I do think that I feel like I could get a little healthier. Great. Like that's a fantastic patient for us to work with. It's like, great, let's dive into optimization. Let's help you be as optimal as possible. Okay? And oftentimes we think of optimal, especially in this country, we think of it as bigger, faster, huger, stronger, mentally, never sleeping, never resting, always doing. It's like, are you kidding me? That is not optimal. That is not optimal at all.
But
that is borderline psychotic, right?
But can I just take like a nicotine pouch and never need to like rest?
Yeah, exactly. You can take a lot of medications, you can take a lot of drugs and stimulants and have it start to overwhelm your body and its functions, right? And you can begin to ignore those signs, which a lot of people do. Frequently people will come in and they're like, I don't really, I'm fine. I don't really, my wife sent me in here but okay, sure. And usually your wife sends you in, or your partner or significant other, they send you in for a reason. But I start evaluating them and they're like, oh yeah, well there's that. And oh yeah, this. And well, I didn't even realize that. And then it's like, oh, you can address cholesterol. Oh, you can help with diabetes and you can help with endocrine issues. And oh, okay. So all of a sudden we have a completely different conversation. But acupuncture, going back to acupuncture, benefits depression, benefits anxiety, it benefits our pain. It can help us speed our recovery, which I don't think we've quite talked about yet. But a lot of runners and a lot of high-end athletes use acupuncture as a recovery mechanism so that they can induce what it does is it induces a little micro trauma or micro circulation. It increases blood flow by doing that, activates the response of the immune system to that area. So it sends a whole bunch of compounds into that area to initiate tissue regeneration and healing.
But that's not overwhelming the nervous system. That's supporting the body to heal.
Yeah, we're working with the body. We are stimulating the mind. We're stimulating the brain to be aware of a certain area, right? And then it kicks into gear, you could say, and then it rights that area. Okay, it's like doing a defrag.
I'm ready to stump you. We haven't talked about this. You know how like peptides are the big hot topic right now?
No, I didn't know.
You've never heard of them. BBC 157, the Wolverine stack, all of them. We've done podcasts on them, and
sure.
You do offer them here in your clinic
peptides,
for patients who come, and it's the right fit, right? What does acupuncture do that peptides are now like really being used for? And maybe you're like, but you should try acupuncture first. Maybe it would solve the issue, right? Like, is there any crossover there?
Well, I think that's a really great.
Like, I was looking at the stomach.
It's a great question.
Yeah, shoulder.
Because a lot of people, peptides, one of the first things that people say is they'll say like, well, semaglutide, tirzepatide, retatrutide, Ozempic, these are all peptides. It's like, well, yeah, they are peptides. That's true. And a lot of them have an impact on gut flora and digestion and the ability of your body to be able to properly digest and have gut motility, or to move through the stool, right? Move the stool through the intestines. Acupuncture itself is a beneficial bacteria promoter. Okay? When you have the appropriate balance of bacteria within your gut, then you're promoting the production of vitamin K. All right. Now I hear a lot of patients, they'll say, oh my goodness, like I can't take, if you don't have K2, you should never take vitamin D. Like, well, let's go back. There's a caveat there. No, it's only because most people have their GI completely screwed up. the balance of flora, the bacteria is completely off. So they're not producing enough K2 in their gut. They're not producing the adequate amounts. So even if they consume vitamin D, they're not getting the vitamin K to help it be absorbed into the bones, be utilized properly in hormone function and production. Okay? So the key is, if your body is functioning appropriately and ideally, or it's optimized, which is what acupuncture does, it focuses on optimizing the body through beneficial neurotransmitter production in the gut and GI by promoting bacteria, right? It will benefit you far more, I think, to do acupuncture and to get on a series of doing acupuncture than to just transfer to doing a medication or a drug. Absolutely. I think it will benefit you far more. However, again, there's always a caveat. However, if you're in a place in your life where your weight is completely out of control and you're not able to get it down, and you've tried a variety of different diets and exercise, and you've tried all of these things, and you just need a little bit of help, a little bit of a bump, some microdosing of those certain medications that were mentioned is probably going to be a beneficial thing. But you know what would be even more beneficial is doing that with acupuncture.
How?
Because how doing it?
Yeah, how would you do that?
So, well, how we do acupuncture is we bring patients in. We have you sit down in a nice, cozy, comfortable room, usually low lighting, and we'll insert specific needles and specific points that are going to relate to those areas of the brain that influence gut and GI function. And remember, a lot of people have heard maybe the term gut-brain axis or your gut brain, or that your gut is your second brain. And now I've even been reading in some articles where people are saying, well, they think maybe the gut is the first brain. And
that's what I was wondering. I'm like, which one is the more important one? Because I was having a conversation with a friend yesterday because I have a lot of gut issues. And she's like, which one is like, I'm like, I think it's the gut first and then the brain. I think the gut sends all the signals. I'm like, if I can solve this gut, then everything's going to go downhill from there. And that's just my perception of it. But it's like, I also want my kids to really trust their gut. I want them to learn to listen to it and intuit what it's saying. And like, I don't know. So I think the gut might be the first brain.
Yeah, I think.
But that's from a spiritual kind of.
Well, but there's there's actually a lot of people beginning that argument, and from the context of, well, if the gut and the GI, we have over millennia, you could say, as humans, as a species, we have developed this symbiotic relationship with bacteria. And over the past 100 years, maybe even less, just less than that, we have developed this or very negative relationship with bacteria, where we have felt like all of a sudden it's our role and our job to kill, to eliminate, to destroy bacteria. But we've existed for millennia, and we've propagated the race on Earth for millennia in a symbiotic relationship with bacteria. Like I read an article once, and the guy says, if
you read a lot of articles, by the way, which is why we love you.
That's all right, but
it's our doctor.
The guy said, and this was not necessarily a professional journal article. It was, he was just writing a specific opinion piece on essentially on bacteria and gut health, right? And he said, we are the majority of our cells are actually bacteria. We have more bacteria, and this is truth. We have more bacterial cell and DNA of bacteria in our bodies than we have human cells, right? So there's more bacteria than us. So if an alien, this is what he said, if an alien came down and shot us all up and broke us up, chopped us up into a whole bunch of little pieces, he would determine that what we were made up of was bacteria. Okay? So you look at that, that's just how symbiotic of a relationship we have developed with these organisms over thousands of years. So our objective really, and this is why I love Chinese medicine, this is why I am so excited about Chinese medicine and going to work every day to be able to help people, is I'm helping them develop a symbiotic relationship with the world, with their bodies, with their experience that they're in right now. It's not our role or our job to be destroying, attacking, and killing everything. And the more that we do that, the less healthy we get. And if you look at it, it's like, if you look at kids who wash their hands, or they use a ton of disinfectant on their hands, right? And so they're constantly squirting. And this happened, I saw this a lot actually during COVID as well, where we had all these like antibacterial, alcohol-based hand sanitizers, right? So people were constantly just hand sanitizing. Well, what does it say? Even on them, it's like kills 99.9% of all germs and bacteria. And it's like, okay, if you start wearing down the germs and the bacteria on your skin surfaces, what happens? Well, you develop rashes. You just start developing all sorts of keratosis. You start developing all sorts of inflammatory conditions because the bacteria is no longer able to properly regulate the surface of the skin because you're killing it. You're getting rid of it. And that same thing happens throughout our body. When we have overutilization of antibiotics, which we have done for certain in our culture, then we start developing superbugs, and we start developing, pushing certain species of bacteria to overcome or to create workarounds, which they do, because they're trying to live and thrive and survive. They've done it with us symbiotically for thousands of years. And so we're losing the race right now to bacteria as it comes to antibiotics. A lot of them are not working properly like they should. And so we're having to dig deeper into discovering, okay, what's going on in nature? What plants have these antibiotic type features? And that's why in our culture, and we'll talk about in our company, I use a lot. I have an herbal antibiotic formula that I've put together. And it has compounds in it that are antibiotic, that are antiviral, antipathogenic, antifungal. And we have great success with that, treating infections. And it works oftentimes. It's not always the 1-2 punch, right? It's not always the answer, but oftentimes we see it working where traditional antibiotics have failed, or the chemical synthetic antibiotics have failed.
And you might put someone on an antiviral protocol, and one of the recommendations is, okay, this, herbal antibiotics and acupuncture twice a week.
Yeah. Absolutely.
I mean, I've seen the prescriptions before.
Yes.
And why do you do that?
So with the acupuncture, I'm promoting a balance within the body and within the gut. I'm trying to optimize the function. So while we're introducing these antibiotic type properties within the plant, and the body is going to pull those out of the plant. That's the difference between a Western medical synthetic antibiotic and an herbal antibiotic, is that the body accesses the antibiotic property or compound by breaking down the plant structure and then saying, oh yeah, let's pull that in, let's let that in. Whereas the synthetic antibiotic, it just forces its way in. Okay. And now we're getting to a point, like I said, that it's problematic we're having a lot of cases where we're seeing that the antibiotics aren't working as efficiently or effectively as they were in the past. So the acupuncture actually helps the body to function more optimally. So when we introduce, even if a patient is on synthetic antibiotics, it's going to help that antibiotic work more optimally. It's going to help it work better in the body because we're optimizing the function of the body.
Is there anyone for whom acupuncture is a bad decision?
That's a very good question. I haven't had anybody, maybe if I've even had some patients where they have a significant phobia of needles, and we had to work through it, right? And they do well now and come in for a regular visit, is what they call it. But yeah, I don't know that there is anybody that should not consider acupuncture, especially if you're dealing with anxiety, depression, back pain, joint pain, osteoarthritis, wanting to improve or recover from any sort of sport or sporting activity, or even just looking at it and saying, I want to improve my immune health, my immune function. right? I want to be more resilient and not have so many colds, or I want to balance my hormones. I want to balance my hormones and help my body. There was a study that was done too with even ovarian cysts, where acupuncture, because of the balance to the autonomic nervous system and also because of the balance to the blood sugar, it allows the body to mitigate insulin release in the body. And because of that, it actually reduces the instant and the size of certain cysts that are formed.
Wow. Is there anything else you wanted to talk about as it related to acupuncture? I know there were some really important points you wanted to make so people out there understood its impact.
Yeah, I think this is good. I honestly, with regard to acupuncture, I would try it sooner than later. And if you're wondering if it could work for something, if it could work for an autoimmune condition, if it could be beneficial in any way for you, it's likely it's going to benefit you. So that's what I would say.
There's massage parlors everywhere you go. There's chain massage places. I mean, massage seems like a pretty widely accepted form of like self-care. It's not as widespread to see an acupuncturist place. If I was like, oh, I want to get a massage to relax, what would be the benefit of doing that versus going to get like an hour of acupuncture?
Well, that's a really great point, because I do have patients who say to me, more frequent than you would think, when they walk out of an acupuncture treatment, they go, oh my gosh, I feel like I just had the best massage of my life. And all we did was put in needles in certain spots. But what the acupuncture does, again, imagine you are in a autonomic nervous system dysfunctional state, which essentially means you're in fight or flight. Well, if you're in fight or flight, you're frantic, your heart's probably a little bit racing or erratic, and your muscle tension throughout the body is more restricted, right? And just imagine that, like your whole body's kind of doing this, but it's become normal for you because you've just done it for so long. And you're like, no, I don't have a problem. There's nothing wrong with me. Well, that's really interesting because your muscles are all so tight, right? You put in certain needles in very specific areas to help relax those tendons, relax those ligaments, and all of a sudden the person's like, wow, my muscles are relaxed. And it didn't require digging in. I'm a fan of massage. I promote it. Absolutely. We have massage therapists here. And so, but in combination with massage, or even apart from massage on its own, can it help somebody relax? Can it release their tension? Can it release their stress? And is stress actually one of the major predictors of early degenerative changes and inflammatory conditions within the body? Yes, it is. Our modern illness is actually inflammation. Anything that you can do to decrease the inflammation in the body is going to be good and advantageous. Well, what does acupuncture do? It helps to optimize the body. So if you're in an inflamed state, how do you decrease that? Acupuncture. Acupuncture
has changed my life for sure, and I'm really grateful for it. If folks want to learn more about community acupuncture, which you offer for multiple people in one room at a reduced rate, you do punch passes, how can they find out more about that here at Community Health and Wellness?
Yeah, you can reach out to us. So the best way to get a hold of us really is to text our number at 435-657-3696. You can also reach out to us on our website at chwheber.com. And you can reach out to me at Dr. Ron Dummar on Instagram.
Ooh, and the Be Well Now podcast on Instagram as well. Please please subscribe, leave a 5-star review if you could. Another episode of Be Well Now.
Namaste, everyone.
Namaste.